Increased class size, how it impacts students beyond the obvious. Presented by Joy Huguley. The purpose of this workshop is to understand increased class size. And when we say increased class size, that's teacher to student ratio as well as spatial density. Understanding how increased class size impacts the identification of the onset of ADHD. Learning how to identify misbehavior versus the onset of ADHD. And discussing short-term and long-term solutions to increased class size. First, we're going to talk about increased class size in terms of student to teacher ratio. Student to teacher ratio is defined as the relationship between the number of students to the number of teachers. In Georgia, current maximum class sizes are kindergarten without a paraprofessional can have up to 18 students. Kindergarten with a paraprofessional can have up to 20 students. Grades 1 through 3 can have 21 students in a class, and grades 4 through 8 can have up to 28 students in a class. Even with these class maximums defined by the state, districts are still seeking the ability to increase class size on average by 5 students, and even some districts seeking as many as 15 above state requirement. So what this means is a kindergarten class without a paraprofessional, instead of having the 18, it can have up to 23. Or grades 4 through 8 class, instead of the 28, it can have up to 33 students. Research shows that decreased student-teacher ratio leads to higher student achievement, moving the average student from the 50th percentile up to somewhere above the 60th percentile. Students, teachers, and parents all report positive effects from the impact of class reduction on the quality of classroom activity. Fewer discipline problems when there is a smaller student-to-teacher ratio. Greater knowledge of students. Students are able to acquire and retain more information. Teachers are more enthusiastic about being there. And smaller class size benefits the students specifically as it relates to behavior, which is where we're going with this workshop. And now we're going to talk about increased class size in relationship to spatial density. Spatial density basically is the amount of physical space that each child is allotted within the classroom. And it should be a very important part of determining class size. Physical class space should be considered when determining class size. Research shows class size should not exceed 17. However, most states have minimum set at 20 students per class, which creates a deficit of 129 square feet. Of course, crowding has a negative impact on students. And that's just with anything. If you're overcrowded, your ability to focus, your ability to hone in on what's most important sometimes is decreased. The nature of the task that the teacher is delivering should dictate the student seating arrangement. So, for example, if you're giving an assessment, students should be all facing the same direction, not able to look on one another's papers, versus if they're in a group work, they should be sitting where they can face one another, interact with one another. But when you have very little spatial density, you lack the ability to switch up the seating arrangements as you see fit. Evidence supports the idea that students display higher level of appropriate behavior during individual tasks when they are seated in rows, with disruptive students benefiting the most. So this is saying that students that are displaying those impulsive behaviors that we normally associate with ADHD, or students that are misbehaving, benefit most when they're able to sit in a way where they're facing the teacher and somewhat away from other students. However, if there's limited physical space for a teacher to do that or make that accommodation, that behavior may still persist. Which brings me to the point of this workshop. So we've all heard the arguments about increased class size in relationship to it affects student achievement. so forth and so on. However, what I want to talk about today is increased class size as it relates to the increase in the diagnosis of ADHD. Within the last decade, the number of children ages 5 through 18 diagnosed with ADHD has drastically increased. According to the study in 2010, 10.4 million children and teens under age 18 were diagnosed with ADHD at physician outpatient visits versus 6.2 million in 2000, which is a 66% increase. In addition to the increase in children being diagnosed with ADHD, class sizes have also increased. Research demonstrates that large class sizes can be detrimental to the learning environment. Research also demonstrates that the learning environment is a direct determinant of student behavior both on task and off task. Some off task behavior students exhibit within a large classroom are not necessarily always exhibited in a smaller classroom, and these off task behaviors could be interpreted as the onset of ADHD. So basically, what this is saying is in addition to increasing class sizes, we've also increased the number of students that we're seeing being diagnosed with ADHD, which led me to question, was there a correlation between the two? Are we diagnosing more students because they're genuinely experiencing symptoms and need assistance with some of the drawbacks of ADHD, or are we diagnosing students because they're exhibiting behaviors as a result of their learning environment? So now let's talk about misbehavior versus the onset of ADHD. Attention deficit hyperactivity disorder or off-task behavior is what we need to ask ourselves. More specifically, is the off-task behavior of a student beyond their control or response to their learning environment? Symptoms of ADHD, such as trouble paying attention and controlling impulsive behaviors and being overly active, can affect children and teens both academically and socially. Several factors need to be considered when attempting to identify the onset of ADHD. So, I just want to debrief here. Basically, what I'm saying is that before you go to refer a student to the SST process, or you begin to identify a student and say, hey, this child may be experiencing ADHD, we must consider the context of this child's behavior. First, of course, is class size. Class behavior was related significantly to class size. And then you also want to look at the strength of the teacher. Is this teacher proficient versus non-proficient? Strong teachers interacted more with their students on instructional matters, and their students spent more time engaged in learning. The climate in the needs improvement classrooms were often characterized by the following cycle of behaviors: student misbehavior, teacher attempts to control the behavior, student persistence and continued misbehavior, teacher retreating in frustration, and increase in student misbehavior. Many of the recommended interventions for misbehaving students is the same, for students with ADHD. So what we're noticing is the things that research-based techniques for dealing with misbehavior are also some of the techniques that they're suggesting to deal with students that have ADHD. In identifying misbehavior versus the onset of ADHD, teachers must have a clear understanding of what ADHD is. Clinically, it's defined as refers to a family or related chronic neurobiological disorder that interferes with an individual's capacity to regulate activity levels, hence the hyperactivity, inhibit behavior, the impulsiveness, and attend to tasks in attention and developmentally appropriate ways. So basically, this is talking about that student who has problems staying focused on an assignment for an extended period of time, always up, out of their seat, moving around, fidgeting, and things of that sort. ADHD still needs a great deal of clarification. The criteria of the definition plays a large role in addressing all issues of the disease. The discussion of ADHD and its effects on education also makes it clear that a more unified and consistent approach is needed to address the needs of students with the disorder. And lastly, it will be beneficial for all countries if research regarding ADHD was not so heavily dominated by the North American Western view. What they're finding is A lot of the research regarding ADHD is heavily dominated by the North American and Western view, which is part of the reason which is attributed to part of the reason why we are seeing an increase in students being diagnosed with ADHD, because the criteria constantly changes. However, teachers must have a clear understanding of ADHD because we play an intricate part in the diagnosis of students and filling out the different forms and questionnaires in attempting to get students diagnosed. Teachers must be very reflective on their practice. What can be done despite class size? Large class sizes are here. It is what it is. However, as teachers, we have to control what we can control. So we must be reflective. Is the classroom environment organized? Do you have a lot of distractions hanging up on the walls? Is there trash? Is it neat? Is it organized? Are behavior expectations clear and consistent? Do students know what is expected of them when they come in the classroom every day? Are consequences and reward consistently given out across the board? Are lessons well planned and thoughtful? Are you prepared to deliver the best instruction? Are the majority of students engaged? If you are teaching and you notice that 75% of your class is disengaged from the lesson, then as a teacher, you should reflect on what it is that you're doing and amend those practices. And just ask yourself, have you done everything in my power to minimize distractions and misbehavior? And that's just a huge part of it. A lot of it is things that we can control, so we must do that. Administrators should support teachers when a deficit is identified, and not just quickly throw kids into the SST process or quickly identify, hey, he may have ADHD. Although that may be the case, are we as teachers and as educators doing everything in our power not to force a label upon a student? And then as teachers, we need to implement strategies for improving student behavior. And this isn't just for students that are displaying behaviors that could be identified as the onset of ADHD, but for all students. Make sure that you're building relationships and developing a rapport. Prompt the correct behavior and verbally reinforce it frequently. If you see a child that you think is developing or on the onset of ADHD, give them opportunities to move around the classroom. And that's not just for students that are maybe on the onset of ADHD, but that's for all students, particularly African American male students. They learn best when they're able to get up, move around, and do. Assign 2 seats to an overly active student dealing with that hyperactivity. Okay, once you are, fidgety and tired of sitting in this seat, move to another seat, and they're able to move between the 2 seats as to not, disrupt the other students. Give them the ability to work using a clipboard in a place where they feel comfortable and able to remain on task. Encourage parents to build physical activity into the students' out of school schedules. Use progress charts and other visual records of behavior to encourage more appropriate behavior. Johnny, if you get 5 tally marks, then you're able to have 5 extra minutes of recess and hold Johnny accountable. However, if you lose these 5, then you lose 5 minutes off of recess. You have to give them incentives to remain on task. Move nearer to students when she or he is becoming restless. Assign a capable study buddy and assign duties that require self-control. Proximity is one major thing that deters misbehavior. However, when you're in a class where the class size is increased, where the physical space is diminished, having the ability to control students through proximity somewhat diminishes. So what does this all mean? Increased class size can increase opportunities for misbehavior and ADHD misdiagnosis. In my practice, I've experienced a lot of times where one teacher is experiencing a problem in her classroom with one student. This student transitions to another classroom, and those problems are diminished. That is almost always an indicator of a teacher centered issue versus a student centered issue. and we have to address those. Increased class size is detrimental to student achievement. Um, Large class sizes really are not beneficial to anyone, and that's something that we've been hearing repeatedly. And large class sizes or misdiagnosis of ADHD also leads to stressing already limited resources. Many schools share counselors, social workers, special education personnel, school psychologists, and so forth and so on. And when they're having to come in to these SST meetings or come in to evaluate students that may not necessarily need to be evaluated, we're stressing resources that are already very stressed. So, what can we do about this in the long term, and what can we do about this in the near future? Short-term goals, of course, would be to continue to equip teachers with the skills to successfully thrive in classes with large student-to-teacher ratios. And that's just giving them those classroom management strategies, providing them with resources, helping them to find resources to create engaging, student-centered lessons, and equip teachers with the knowledge to understand and identify ADHD. A lot of times, especially new teachers, we've been through that basic special education class. However, we don't necessarily have all the tools that we need to be successful in identifying students and different learning disabilities that they may be experiencing. So, equipping teachers with the knowledge to say, hey, this may be ADHD versus, hey, this is just Johnny misbehaving in class. And that may lead to some of the decrease in the amount of students being diagnosed with ADHD. And our long-term goals, of course, we need to acknowledge the negative impact large class sizes have on students as well as teachers. Large class sizes are attributed to teacher burnout, increased teacher stress, which then leads to negative interactions with students, or maybe negative perceptions, a little bit more frustration when you're filling out those forms. Are you being unbiased? And things like that. Look further into if increased class sizes really help school budgets, or is there an offset in the increased need for support? So, in the money that you are potentially or allegedly saving in increasing class sizes and reducing the number of teachers you must hire, is that being balanced out in the amount of personnel that's needed to come in for those SST meetings, to come in and diagnose those students, to examine and assess those students to see if they are truthfully dealing with symptoms of ADHD, and continue to vote for politicians and board members that support decreased class size, because decreased class size is the only way that we're going to improve student achievement. So that is all. I hope that you were able to gain some insight on how increased class sizes could possibly be linked to the increased number of students that we're seeing being diagnosed with ADHD.